Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our Health Talk today is Hepatitis C virus. Joining us today as my guest speaker is Dr. Rushdah Malik, and she is a clinician practicing infectious disease in local area. She's going to highlight our viewers about what is hepatitis C virus, who gets it, what are the preventive measures, how you can avoid, and the new drugs that have come up in the market. So good morning, Rushdah, and welcome to my show.
Good morning. Good morning, Dr. Prasad. It's always been a pleasure.
I know. We are very happy to have you. Before we start, can you just give me a short introduction about yourself?
Yes. So I'm in practice for over 10 years now, and I work with the local infectious disease clinic.
Okay.
And I provide care for infections, all kinds of infections, acute and chronic infections.
Right. That is very great. Last time we talked about the AIDS.
Right.
And now it is hepatitis C. So to start with, tell us what is hepatitis C virus?
Yes. So, it's really struck me that when I ask people about hepatitis C, and a lot of people did not know that even they should be tested about it. Mm-hmm. It's a virus which is there for a long period of time. Just like other hepatitis viruses, we have three viruses, hepatitis A, B, and C. But hepatitis C virus can cause chronic disease. And we have, unfortunately, new cases every year. Thousands of new cases every year is adding to the list.
Right.
Hepatitis C virus is a virus that attacks liver and cause inflammation of the liver. And then it can stay in the system for a long period of time and cause more liver damage. The one thing that people don't understand, that if it stays in the body for that long, it can lead to end-stage liver disease or liver failure.
Exactly.
And that cause more morbidity and mortality and add burden to health of people, health of community, and health of nation.
So that is very interesting too. Back in older young age, like we see patient with a cirrhosis of the liver, see the emergency room. We really don't know what was the cause. Right. We blame everything to alcohol.
Right.
But now, for viewers to know, alcohol is not the only cause that causes cirrhosis of the liver. There are other causes.
Right.
And one of them is this virus.
This virus.
Yeah.
Along with hepatitis B virus, hepatitis B and hepatitis C virus are the major, major player in this liver inflammation.
Yeah.
I mean, although I would say that people who have underlying lung disease, whether it's from alcohol use and other medications, they can be at higher risk of having more damage to the liver.
Yeah.
Hepatitis C virus can occur in two forms. One is acute hepatitis C virus, and the other one is chronic hepatitis C virus. Okay. Acute hepatitis C virus is, by definition, can happen in first 6 months. So after accusation of the hepatitis C virus, it can be spontaneously recovered or cleared by the body, and it can be done in first 6 months. But once hepatitis C virus make more home to the liver and cause more inflammation, and after 6 months stay in the body, we call it chronic hepatitis C virus. Okay. And that's more damaging. It slowly, progressively damages the liver, and it's amazing to know that over 20 to 30 years,
I saw
it
the
can
figure,
cause cirrhosis of the liver.
Yeah, I saw that figure, and amazing how silent it could be.
Exactly.
Affecting the liver.
Right.
And the symptoms are vague, isn't it?
Yeah, exactly. So that's why it's so important that our communities, our people know about this virus.
Right.
Not everyone has a lot of symptoms. In fact, majority of patients, even with acute hepatitis C virus, studies have shown that only 15% of people have symptoms, and rest of the people have no symptoms at all.
No symptoms.
Right.
Yeah.
Now, those symptoms, acute symptoms, people will know right away. People have jaundice. They have yellow skin.
Yeah.
People feel very tired. They have nausea. They have vomiting. They complain of abdominal pain. They have dark urine. So that's something, make people to know and, attend what's going on. But other than that, sometimes it can be just very vague symptoms. People feel tired for a couple of days, and that's it.
But the symptoms are so vague, whether it is hepatitis B or hepatitis C. Same vague symptoms, nausea, vomiting, loss of appetite. But jaundice is very significant, right? But jaundice does not occur initially.
Right.
With the hepatitis C.
So that's the problem. With hepatitis C, we don't see jaundice in every case. The only virus which we have seen, hepatitis A virus, which causes acute hepatitis, that has majority of patients have shown jaundice in that disease. Because hepatitis C virus is a very slow, progressive virus that causes minimal inflammation in the beginning, so we don't see a lot of symptoms coming with it, and we don't see jaundice until it gets to the late stage.
Right,
and
exactly.
That's why it's important to know about this disease, because at the late stage we may not have a lot of room to treat those patients. And the one problem that we always come across and tell patients is that it can lead to liver cancer.
Right.
So there,
I was going to ask you what is the incidence.
And we'll talk about it more
liver
and more
cancer,
in our
right,
talk, that although there is only, small percentage of people, 15 to 30% can lead to liver cirrhosis. And after that, from those, only 1 to 5% can develop liver cancer. But there is association with liver cancer. And our main job is to make sure that we not only treat this virus, but by treating earlier, we prevent cancer.
You can prevent cancer. So that is very important, When I was doing my residency fellowship in pathology at Children's Hospital, I used to see those slides, with the cirrhosis of liver, those nodular changes and all that. But at that time, we did not know. We did not know that it could be this particular virus that is causing all this. So it was very subtle, but now with all this improvement, all this workup that has been done, it has become very significant. So that's good. And then what the symptoms you already mentioned, right? The symptoms, but what other problems, complication? Yeah, we talked
about the complications.
Yeah, liver cirrhosis. Can you highlight our viewers about that before we go how diagnosis is?
Right. So the one thing I want to go back and talk to you about how people get it. I think that's very important to know that.
Very important.
How to prevent it. And
mode of transmission.
Right. Mode of transmission is mainly through blood and any bodily fluids. Now, more so with hepatitis C, it's patients who has hepatitis C and his or her blood get mixed with anyone else. So for example, people who do sharing of the needles. So injection drug users, and especially when they're sharing needles, that's the most common cause of transmission nowadays. And that's why there's a lot of awareness, lot of campaign to educate those people not to share needles.
Share the needle,
The other form is by a mother who is infected with hepatitis C virus. It can go to the newborn or go to the baby. So baby can get infected. That's why there's been recommendation from American Task Force that every pregnant female should be tested for hepatitis C virus and take appropriate measures for that. The other mode of transmission is by any open sores or any blood contamination.
Contamination. You mean contamination from the contamination.
If you are handling those things. So accidental needle stick injuries is another one that is very common or can happen. Not very common, but can happen, especially in healthcare settings. So we as healthcare workers been trained to make sure that when we draw blood, when we take care of patients with open wounds or open sores, we have to be careful, especially people with hepatitis C virus. We have to be careful. We should be wearing gloves and avoid as much possible any needle prick injuries and use, those safety caps and those
Yeah.
containers where we can dispose those needles.
Yeah.
Those are the majority of modes of transmission. People who had received blood transfusion or organ transplant before 1992.
Yeah, I was going to ask you that when I read about this. So what, before 1968, right?
1992. So
1992.
there were some, screening happening, but not especially for hepatitis C. And after July 1992, United States has mandatory, screening tests, which is for hepatitis C in particular there. So anyone who has received blood transfusion or blood products before 1992, we also recommend those people should get tested for hepatitis C virus at least once in their life.
That is very important point for our viewers to know. Before 1992,
Right.
if you had, then you
Any
worry.
blood transfusion.
Yeah.
In fact, American Liver Study Disease and Infectious Disease Society of America have postulated together all the recommendation, and they have a website for hepatitis C virus treatment and management guidelines.
Right, okay.
And any physician can go on that website and have a whole management process to review from there, and it's more easier nowadays to get to website and get all the
CDC,
information.
always you can get to the CDC and see the recommendation.
Right, CDC recommend to go to that website and get all the information, and all those societies have said that at least once in the life, everyone who is above 18 years of age should be tested for hepatitis C virus.
Yeah, so that's very good to know,
Because we wanna find those people.
Early diagnosis
is so crucial.
Yeah,
so that
with the early treatment. Yeah.
Exactly, we can do treatment. We can prevent this disease from happening, and we can prevent, in fact, the end-stage liver disease and cancer.
Yeah, so you can prevent the end stage by getting early diagnosis. All these things are available now. Before we didn't have so much available. So now, can you please, how is it diagnosis, about the diagnosis? I know first history, physical and all that, and then the hepatitis C antibodies, right?
Right.
Could you comment on that one?
You said it right. I mean,
because
of course,
you are the expertise in this area.
Right. So we are so happy that we do have now such a good treatment. It's a highly effective treatment, and it has really revolutionized the whole trajectory of the hepatitis C virus infection. So again, as I said, the symptoms are so vague, so we do start with the history and exam, and then we also go for blood testing. So hepatitis C virus hepatitis C antibody is something that is a blood test we can do in every patient. Once patient has hepatitis C infection, the hepatitis C antibody is positive and it stay positive for life.
So is that like a seropositive?
Yes.
The other term for it's seropositive.
Exactly.
Means it's hepatitis C antibodies.
Right.
You had got it sometimes.
When person develop antibodies for hepatitis C virus, they stay in their body for life.
Okay.
So once we have hepatitis C virus antibody positive, then that person is a high risk person.
High risk.
And we don't know whether the has cleared the infection on its own or whether they have chronic hepatitis C. So then we do hepatitis C virus polymerase chain reaction test, which is hepatitis C virus
I read
PCR.
about that test that they are doing it.
And I think that's had
polymerase
revolutionized the industry more and more in terms of testing. So we are now doing quantitative test, and hepatitis C virus, if the PCR test is positive, then we go for further testing. Hepatitis C virus, PCR quantitative analysis that tells you how many thousands or millions of copies of hepatitis C virus are circulating in the bloodstream.
Is there a guideline how much virus, if it is above or no?
So this is different. For hepatitis B, there is certain guidelines and number that if the if the patient has that much number, then they should be treated. But hepatitis C virus can cause severe damage. Whatever number, once they are positive, when the PCR is positive, then you treat those patients.
Okay.
It can cause severe liver damage. So, and the other thing is we have treatment for hepatitis C. We have cure for hepatitis C now.
That is true, yeah.
And so whenever we find that people who have hepatitis C virus infection by doing those diagnostic tests, then we further evaluate those patients in our clinics. So patients these two tests can be done anywhere, the PCR test and the antibody test. And once they are diagnosed with hepatitis C virus, then they come to special clinics for hepatitis C.
Okay.
Although anyone can
now, as a clinical practitioner myself, maybe general practice, I would do those. I would order those tests, right? And then I will refer them to you.
Right.
Is that correct?
Right.
Okay.
That's true. As I said, anyone can treat. There are guidelines present and available, but then again, they need a little more testing, special testing. Some of the tests, I'll tell you, there is a FIB-4 score, FIB score we do.
Oh, okay.
And that tells you the staging of the disease, how advanced is the disease. The other one is FibroSure test. These are looking at inflammation of the liver and how advanced is the inflammation. These tests look for liver function test, which is AST, ALT. They look for INR. They look for, the inflammation in the liver, how much prothrombin time, and also put together all these in the formulas and, correctly come up with the stage of the disease from stage 0 to 1, 2, 3, or 4. Once we know the stage of the disease, then we know which treatment is the best for that patient.
Right. Yeah.
There's one more test which is like an ultrasound. It's elastography, which is fibroscan test. It also measures the stiffness of the liver. The more stiff is the liver.
Ultrasound is being done just to see how firm liver is, right?
It measures the firmness of the liver. It's called fibroscan. And that tells you how, if more stiff or more firm, then we know that liver cirrhosis is there. So it kind of gives us more idea of the stage of the disease.
So that's very good now. So then the treatment, now we will, every day, on the television, CNN, they advertise about all those new medicine for hepatitis C.
Right. I'll tell you, it's such a success story. Even for me, when I was doing fellowship, we had treatment where the patients have to take a lot of injectable medicines, a lot of pills, and even with that, success rate was only 30 or 35%. But now with the new medication, since 2011, we have new protease inhibitors for hepatitis C virus.
And the protease inhibitors.
Those have increased the rate of success to above 95%. Can you see that?
So, that's great to know.
It is such a good news, and that's why we want to promote more and more people to get diagnosed. If they have hepatitis C, they should not be waiting. They should not be causing more years to go by and that have developed hepatitis C. We want to have early detection and treat. And also, treatment is more successful in patients who are in early stages of the disease. So based on those new guidelines, we have 2 options available. So there are 2 protease inhibitors. These both are combination of 2 pills, but it comes in a 1 pill form. And those can be given from anywhere 8 weeks up to 12 weeks. It's 1 pill once a day, less side effects, and people tolerate it very well. And after the treatment is done, we monitor them for a year. And make sure that they are free of virus. But as I said, above 95% cure
and
rate and success rate.
It is so easy because they just have to swallow pills, right?
Exactly. No more injections, no more side
more
effects.
injections.
People used to have a lot of side effects from those older medications. People were anemic, their platelet counts were going down. Hepatitis C virus, as we talked about, causing liver inflammation, people with liver cirrhosis, they have already platelets count going down.
Exactly.
So they have more issues
clotting factor is disarranged.
And then they have more chances to bleed. And when they were going into liver cirrhosis and end-stage liver disease, it was very hard to cure or to provide any effective management at that time. Now, as I said, 95% cure. 5% of the patient where they are at the end-stage liver disease with cirrhosis,
right,
it's very hard to revert it back. And those are the ones where we can have complications, and those are the ones we also are more worried about liver cancer. But majority of patients above 95% have a good cure rate. We call it sustained virological response once patients are on this highly effective therapy. Within 2 weeks and up to 4 weeks, we see sustained virological response where there's no more virus detectable in their bloodstream.
Yeah. So this is great to know with all this medicine that have come in market, for now. What are the preventive? How can somebody prevent? Very important,
Right.
The first of all, I see everybody with a tattoo, some clinics.
Right.
So that could be, that is a good mode of transmission, isn't it?
Exactly. So as we talked about mode of transmission, if we prevent and educate people about needle sharing, do not share needles at all, and especially if people who have hepatitis C virus, they should be very careful about their needles and should use disposable needles.
Right.
The other important thing, and you reminded me, I think early on we kind of touched on needles, but tattooing and piercing.
Tattooing,
it's a big industry.
In the clinic, I see those people with that.
And it's a big industry, and we want to make sure that we always go to certified places. We want to make sure that they are using sterilized tools, especially if attending anyone with hepatitis C virus, they should use unopened inks.
Yeah.
So ink can be infected, and the needle can be, have a blood on it when you use it for hepatitis C virus infected person. If they're not using, changing needles in between, if they're using the same ink, the patient, the next person can get hepatitis C virus from there.
Yeah.
So people should be very careful. When they go, they should ask for what kind of tools they use, whether they're using disposable needles, whether they are changing needles in between, all those things. So those are the major things that we can prevent this disease.
We can prevent this.
The other thing is, of course, awareness about, people should get tested at least once. So anyone who comes to your clinic for even annual exam, they should get tested so that we do early diagnosis.
Usually we order the liver screening.
Right.
That includes all this.
Exactly.
Yeah.
True.
But then, sometimes it's still very hard to control these people. It's okay when you are adult, but when you are a teenager, a couple of years ago, I wrote an article about salad bowl syndrome. How these kids, they are the candies which looks like drugs, and then then they share needles, just to make themselves high. So those are the people, that's the dangerous part, isn't it?
You are exactly right. And nowadays there is a, more awareness and education we need to provide to our young generation, especially when they are in those parties and people are using different chemicals and different drugs. Those can be mixed with anyone who has hepatitis C virus, and those are the things that people have to be, those are the people who are at high risk of getting hepatitis C virus, so we have to be aware of those, risky behaviors. Also, people with HIV, people with male having sex with male, those are the people who are at high risk of acquiring hepatitis C virus.
So this is very good and such a good information about these kids. So right now I'm in the process of writing something about what are the precautions, safe immunization for a college students. I'm done with the school. Schools are closed, but now they're entering the college. Do you think this should be number one in the list, the hepatitis C vaccination?
Right. So we don't have a vaccine for hepatitis C.
Yeah,
right?
just a protection.
And that's why we always should tell our patients, especially younger generation, everyone, that they should get vaccinated for hepatitis A and B.
Right, that's what I was going to ask you. Hepatitis A and B, get them vaccinated.
Get them vaccinated, right?
Yeah.
As early as possible, because the more burden on the liver, more inflammation. People have hepatitis B and hepatitis C virus,
right.
although they compete for each other. People can have HIV and hepatitis B virus. So those are the conditions where patients can have more liver burden.
So that immunization.
So whenever there's a chance and whenever we can vaccinate people, we should vaccinate people for those hepatitis A and B viruses. And my message is prevention is the real goal for hepatitis C virus.
Right.
If we convey this message to general public that be aware, especially whenever there is a chance, be away from any bodily blood products and blood, especially when you don't know the person who has hepatitis C virus.
Exactly. And when you are in college campus, you meet people from all over. Schools were little different.
Right.
But here there is so much.
One more important thing that also some people ask me these questions, also should take care of those personal items people use. If you are being roommate with someone, if you are sharing the bathrooms with someone, then be careful. Do not use any person's razor or toothbrushes or nail clippers. Because that could be one way of transmission of hepatitis C virus. So those are the things you have to keep those personal items, away, and be careful about not to sharing those items with anyone else.
So last minute key advice, what would you say?
We always want to make sure that our viewers know about this in a nutshell, that hepatitis C virus is a chronic hepatitis infection. It's a chronic disease. It can cause liver damage. It can cause liver damage to a point where people get liver transplantation. And, it is one of the most common cause of people get evaluated for liver transplant. So why get to that stage, right?
Right.
So we have to
prevention.
We have to prevent it. We have to detect it early. And at the same time, whenever diagnosed, then treat those patients effectively. If you can treat those patients. We have very simple now management, very simple treatment available, 1 pill a day. And if you don't know, and you don't want to treat those patients, then you can refer to them to the specialist.
Exactly.
And,
most of the health centers all over, they are connected to a specialized clinic for this.
Right. And last but not least, we also want to make sure that we prevent liver cancer.
Exactly.
So it is one of the cause of liver cancer. So when we treat this infection early on, we prevent liver cancer. Now, there is a caveat, although even after treatment of hepatitis C virus, there is a very few % chance of having a liver cancer.
Exactly.
But this is majorly based on the liver inflammation, liver damage. The more cirrhosis, the more changes in the hepatocytes, liver cells happening, the more chances of liver cancer.
So I'd like to thank you. I'd like to thank our viewers for watching me on my health talk with our guest speaker, Dr. Malik. And she has a clinician with the infectious disease. And the topic was prevention of hepatitis C virus and its effect on the body. Until I see you again, have a very safe and a wonderful rest of this summer. Thank you very much.
And thank you so much.